Hello, it's Nurse Kathy. You may have just received a letter from your child's school informing you that there was a staff person or student at your child's school who was diagnosed with COVID-19. The letter states case identification. This letter is notification of a positive or probable case in the school building. You will not be provided, nor will you receive any student or staff identifying information about the affected individual. Notifying parents and staff of any positive or probable case in the school is part of our district's strict management of COVID-19 in the schools. If you receive this letter, there is no action that is required for you or your child. If any further action would be needed, you would be contacted directly by phone or by email. If you receive the case identification letter and have not heard from the school nurse or from the building administrator, then you can be completely reassured that your child has not had any risk of transmission of COVID-19 at the school from the positive individual. How can I say that? Well, when we received notification that an individual tests positive, we work quickly and thoroughly to identify close contacts. This is an important mitigation strategy that the district is following. Efficient identification of close contacts is an important public health strategy to decrease COVID-19 illness transmission. We are strictly following the district's mitigation plan as outlined in the district's COVID-19 preparedness and response plan. Because we are managing student and staff illness, as well as we're all wearing face coverings, physically distancing in the schools, and we are keeping students in the same cohort groups, we are encouraging frequent hand washing, we are all doing daily screening for illness, we are staying home with symptoms of illness, as well as managing all possible and probable COVID-19 cases in school. We have not experienced any in-school transmission of COVID-19 in the elementary schools or in those programs that are meeting in school. If your child is identified as a close contact to a positive individual in school, you will be notified immediately and advised on what to do next. And that would be a 14-day quarantine from the last date of contact with the positive person. A close contact is defined as being less than 6 feet for more than 15 consecutive minutes to a positive individual when at school. This is why we have the desks spaced apart and why we limit any close interactions with students and staff. So if a student or a staff tests positive, we can quickly identify close contacts and provide guidance for the close contact. Because of our mitigation measures, we do not need to quarantine entire classrooms. If your child is not identified as a close contact in a classroom or a school building where there's been a positive individual with COVID-19, your child can safely attend school. However, please know that there may be some classrooms where physical distancing is just not possible. In those classrooms, we will be providing guidance in terms of quarantine for the students in the classroom. Please know that we are all doing everything we can to keep our schools and our students and our staff as safe as possible. While we can't control what is happening with COVID transmission outside our four walls, we can control what we do inside our four walls in our schools. Thank you all for your efforts in reinforcing healthy behaviors with your child. Thank you for sending your student to school with a mask on. Thank you for managing your child's symptoms of illness at home. Thank you for keeping your child home if they are a known close contact. And thank you for alerting us if you or your child tests positive for COVID-19. Together, we will get through this. Thank you.